Keratoconus is an ophthalmologic disease. Look at this picture shows that normal cornea and keratoconic cornea. Look at this cone shape. Then corneal topography and cross retinoscopy with simulator for diagnosis. A detail going on. Introduction. Keratoconus is a progressive eye disease that affects the cornea, causing it to thin and bulge into a cone like shape. This abnormal shapes distorts vision, leading to visual impairment. This condition typically begins in adolescence or early adulthood and progression gradually over time, often leading to significant visual impairment. Keratoconus can affect one or both eyes and may require long-term management, including corrective lenses or in severe cases surgical interventions. Etymology. The term keratoconus is derived from the Greek word kerato, meaning cornea, and conis, meaning cone, referring to the cone-like shape the cornea takes on as it thins. The name reflects the characteristic distortion of the cornea seen in individuals with this condition. Definition. Keratoconus is a condition where the normal round cornea becomes progressively thinner and bulges outwards, resulting in cone-shaped destruction. This deformation of the cornea causes visual disturbances including blurred vision, glare, and sensitivity to light. Types. Keratoconus can be classified based on the severity and progression of disease. 1. Mild keratoconus. The cornea shape begins to change slightly and vision problems can be corrected with glasses or soft contact lens. 2. Moderate keratoconus. The coronal bulging becomes more pronounced and vision may be corrected with specialized contact lens such as rigid gas permeable lens or scleral lenses. 3. Severe keratoconus. The cornea becomes very distorted and vision may not be adequately corrected with glasses or correct lenses. Surgical intervention may be necessary. Causes. The exact cause of keratoconus is not fully understood, but it is believed to involve both genetic and environmental factors. Contributing factors include 1. Genetic mutation. Inherited forms of keratoconus are common, especially in individuals with family history of the condition. 2. Environmental factors. Chronic eye rubbing, exposure to allergens, and certain systemic conditions, example Down syndrome, Ehlers-Danlos syndrome, can contribute to the development of keratoconus. 3. Biochemical imbalances, a weakening of the central collagen structures and imbalance in the production of enzymes may also play a role. Risk factors. Several risk factors are associated with keratoconus. 1. Family history. The genetic predisposition increases the risk of developing keratoconus. 2. Eye rubbing. Chronic rubbing of the eyes may exacerbate or accelerate the disease. 3. Systemic diseases. Conditions like Down syndrome, Marfan syndrome, and Ehlers-Danlos syndrome can predispose individuals to keratoconus. For other eye conditions, allergic conditions like vernal keratoconjunctivitis or atopic dermatitis may increases the risk. Complications. Keratoconus can lead to several complications, particularly if not treated properly. 1. Corneal scarring, as the cornea thins and distorts. Scarring can develop, worsening vision and making it more difficult to correct with lenses. 2. Corneal transplant, in severe cases where the cornea become too damaged, a corneal transplant may be required. 3. Increased risk of eye infections. The altered shapes of the cornea can increase susceptibility to infections. The pathophysiology of keratoconus involves several stages, beginning with changes at the cellular level and leading to structural alterations in the cornea. 1. Genetic and biochemical changes. 2. Corneal thinning. 3. Breakdown of collagen. 4. Increase oxidative stress. 5. Corneal bulging. 6. Loss of structural integrity. 7. Corneal scarring. 8. Progressive visual impairment. As the corneal continues to thin and change shape, visual acuity worsens and individuals may experience difficulty in seeing clearly, especially in low light or at night. Glasses and regular contact lens may not longer provide adequate correction. 9. Risk of complications. Over time, individuals with keratoconus may be at risk for more severe complications, including corneal infections, corneal hydrops, or swelling, and in extreme cases, need for corneal transplantation. This step reflects the progression of keratoconus, which begins with biochemical and structural changes at the cellular level and ultimately leads to the clinical manifestations of the disease. Signs and symptoms. Common signs and symptoms keratoconus include 1. Blurred vision as the cornea becomes more distorted, vision becomes increasingly blurred and difficult to correct with glasses. 2. Sensitivity to light. Photophobia. Patients may experience discomfort in bright lighting conditions. 3. Halos and glares. Vision may be accompanied by halos or glare, particularly at night. 4. Frequent changes in prescription. The need for frequent changes in glasses or contact lenses due to worsening vision. 5. Double vision, especially in severe cases where the cornea is highly distorted. Diagnosis. Keratoconus is diagnosed through a combination of clinical examination and specialized test. 1. Slight lamp examination. A microscope used to examine the shape of the cornea and check for signs of thinning or bulging. 2. Corneal topography, a mapping technique used to measure the curvature and shape of the cornea, helping to detect early signs of keratoconus. 3. Pachymetry measures the thickness of the cornea to assess if it has thinned in the central area. For retinoscopy, a test that helps assess the way light reflects of the retina, indicating changes in refractive errors due to corneal irregularities. Nursing diagnosis. Possible nursing diagnosis for patient with keratoconus include impaired vision related to corneal distortion and thinning, to risk for injury related to reduced visual acuity and night blindness, for deficit knowledge regarding the disease process and treatment options. 5. Risk for infection related to the use of correct lenses or surgical interventions. 6. Disturbed body image due to the progressive nature of the condition. Management. Medical management. 1. Contact lenses. Special contact lenses such as rigid glass, permeable lenses are commonly used to help improve vision. 2. Corneal cross lining, a treatment that involves using ultraviolet light to strengthen the corneal tissue and slow the progression of the disease. 3. Corneal transplant in severe cases where other treatments are ineffective. A corneal transplant may be necessary to restore vision. For surgical options, other procedures such as intrastromal corneal ring segments (ICRS) may be used to correct corneal shape. Nursing management. 1. Monitor visual acuity, regular assessment of vision to track disease progression and response to treatment. To patient education, educating patients about their condition, the importance of adhering to prescribed treatments and proper contact lens care. 3. Promote comfort, encourage the use of lubricating eye drops to alleviate dryness and discomfort. 4. Supportive care, provide emotional support, especially in case where the disease affects self image or quality of life. Treatment options. 1. Contact lens, rigid glass, permeable lens, or scleral lens to improve vision. 2. Corneal cross linking, a procedure to strengthen the corneal tissue and halt the progression of keratoconus. 4. Intacs, intrastromal corneal ring segments are surgically placed to reshape the cornea and improve vision. For corneal transplant, in advanced cases, a full or partial corneal transplant may be necessary to restore vision. 5. Topography guided treatment, laser treatment to smooth the corneal surface. Psychosocial medicine. 1. Patient education, educating the patient about the nature of keratoconus and the available treatment options. 2. Counseling, offering counseling services to help patients cope with the emotional impact of the disease, especially in severe cases. 3. Support groups, encourage patients to participate in support groups where they can share experiences with others facing similar challenges. 4. Body image support, provide emotional support for patients with who may feel self-conscious about their appearance or visual impairment. 5. Encourage adherence, foster a collaborative relationship with patients to ensure compliance with prescribed treatments, including the proper use of contact lenses or post-surgical care. Prevention. While keratoconus cannot be entirely prevented due to its genetic components, certain measures can reduce the risk of progression. 1. Avoid eye rubbing. Chronic eye rubbing can exacerbate keratoconus and lead to more rapid progression. 2. Early detection. Early allowing for timely intervention, regular eye exam can help identify the condition. 3. Manage allergies. Proper treatment of allergies and associated eye conditions can reduce the risk of aggressive keratoconus. For proper contact lens care for individuals using contact lens following proper hygiene and care, instruction is essential to prevent infection or irritation. In conclusion, keratoconus is a progressive and often debilitating condition that affects the cornea, leading to distorted vision. Early diagnosis, appropriate management, and personalized treatment plans can significantly improve outcomes and quality of life for individuals with keratoconus. With advancements in treatment options, including corneal cross linking, contact lenses, and surgical interventions, individuals with keratoconus can lead normal life despite the challenges posed by the condition. Thank you. Have a wonderful day.